Hi guys, welcome to my channel. My name is Nuna, and in today's video we're going to talk about the different types of acne and how to treat them. So if you're interested in learning more about the different types of acne and how to properly treat them, keep on watching this video. Okay, the first thing you should know is that acne is caused by clogged pores as a result of an excess production of oil or sebum, dead skin cells, bacteria, hormones, and even ingrown hairs. And because acne is a relatively common condition, it's important to know the type of acne you have so that you can effectively treat it. And keep in mind that it's possible to have more than one type of acne at the same time, and you can have acne on any part of your body. As mentioned earlier, there's several different types of acne, and these are blackheads, whiteheads, papules, pustules, nodules, and cysts, and they fall under one of two main categories, which are inflammatory acne and non-inflammatory acne. Now let's discuss blackheads and whiteheads. These fall under the category of non-inflammatory acne and are the mildest form of acne. In general, non-inflammatory acne tends to be easier to treat than inflammatory acne because they do not normally cause swelling and they respond well to over-the-counter treatments. Blackheads or open comedones and whiteheads or closed comedones are formed in the same way when a pore becomes clogged by excess production of sebum and dead skin cells. The only difference is that for blackheads or open comedones, the top of the pore remains open, resulting in the typical black color that you see on the surface of the skin, while for whiteheads or closed comedones, the pore is closed on top, and that results in the typical tiny bump that you will see on the surface of the skin. Next we have papules and pustules. These are a more moderate form of acne and they fall under the category of inflammatory acne. And they may or may not clear up with over-the-counter treatments that contain salicylic acid or benzoyl peroxide. If you have widespread moderate acne, you may require an oral or topical prescription from a dermatologist in order to effectively treat it. Keep in mind that you can also use topical retinoids to treat inflammatory acne such as papules and pustules. Papules and pustules are formed when walls around pores are broken down due to severe inflammation. The only difference is that pustules are filled with pus and have yellow or white heads on top of the pimple, while papules are tender to touch and the skin is red or pink in color. Finally, we have nodules and cysts. These are the most severe forms of acne compared to all of the others. If you have this type of acne, it's recommended that you consult a dermatologist for treatment to clear up any severe breakouts. Another thing to keep in mind is that picking or popping nodules or cystic acne can lead to scarring. Nodule acne is formed as a result of clogged, swollen pores and are located deeper beneath the skin surface as compared to papules and pustules. Because of its location deeper beneath the skin surface, it's harder to treat and therefore may require prescription medication in order to effectively treat it. Now let's move on to cystic acne. Cystic acne develops when pores become clogged by a combination of dead skin cells, bacteria, and sebum. And they occur even deeper within the skin as compared to nodules. And because of their location deeper within the skin, it's more likely to cause scarring. Cystic acne are the largest form of acne and appear as large red or white bumps and are painful to the touch. And prescription medication is often used to treat this type of acne. And in severe cases, your dermatologist may choose to surgically remove cystic acne. So overall, blackheads and whiteheads can be treated with over-the-counter treatments that contain salicylic acid or benzyl peroxide, while moderate inflammatory acne like papules and pustules can also be treated with over-the-counter treatments that contain salicylic acid or benzyl peroxide, or an over-the-counter retinoid such as Adapalene or Differin. Keep in mind that if you're using an over-the-counter retinoid, you should also use a sunscreen because of increased sensitivity to sunlight. And for nodules and cystic acne, prescription medication may be required for effective treatment. Hopefully you found this video useful. If you liked this video, please hit the like button. Please comment down below what you'd like to see next, and please subscribe so you don't miss my next video. Thank you for watching.